addition to BMI and charting weight on the growth chart, the doctor also evaluates family histories of obesity and weight-related health problems such as diabetes, children's eating habit, active level, and other health conditions child may have. Childhood obesity can have a complication for the physical, social, and emotional well-being of children. Physical complication. Type 2 diabetes in children is a chronic condition that affects the way your children's body metabolizes sugar. Metabolic syndrome is not a disease itself, but a cluster of conditions that can put your children at risk of developing heart disease, diabetes, or other health problems. High cholesterol and high blood pressure. Your children can develop high blood pressure or high cholesterol if he or she eats poor diet. Asthma and other breathing problems. The extra weight on your children's body can cause problems with the development and health of your children's lungs, leading to asthma or other breathing problems. Sleep disorders. Obstructive sleep apnea, a condition in which your children may snore or have abnormal breathing when he or she sleeps. It can be a complication of childhood obesity. Pay attention to breathing problems your children may have while sleeping. NAFLD, this disorder, which usually causes no symptoms, causes fatty deposit to build up in the liver. NAFLD can lead to scarring and liver damages, early puberty or menstruation. Being obese can create hormone imbalances for your children. These imbalances can cause puberty to start earlier than expected. Social and emotional complication. Low self-esteem and bullying. Children often tease or bully their overweight peers, who suffers a loss of self-esteem and an increased risk of depression as a result. Behavior and learning problems. Overweight children tend to have more anxiety and poorer social skills than normal weight children have. Depression. Low self-esteem can create overwhelming feeling of hopelessness in some overweight children. Obesity is the sixth major cause of disease risk worldwide. It has been estimated that 1 billion adults are currently overweight, and an additional 470 million adults are obese. It has also been estimated that 200 million school-aged children are either overweight or obese worldwide, and that 40 to 50 million of these children are classified as obese. More than one-third of U.S. adults are obese. It is 34.9%. Non-Hispanic Black have the highest age-adjusted rate of obesity, 47.8%, followed by Hispanic, 42.5%, non-Hispanic White, 32.6%, and non-Hispanic Asian, 10.8%. By state, city prevalence ranged from 20.5% in Colorado to 34.7% in Louisiana in 2012. No state had a prevalence of obesity less than 20%. 9 states and the District of Columbia had a prevalence between 20 to 25%. 13 states had a prevalence equal to or greater than 30%. Higher prevalence of adult obesity was found in the Midwest, 29.5%, and the South, 29.4%. Lower prevalence was observed in the Northeast, 25.3%, and the West, 25.1%. Approximately 17% of children and adolescents aged 2 to 19 years are obese. The prevalence of obesity among children aged 2 to 5 years decreased significantly from 13.9% in 2003 through 2004 to 8.4 in 2011 through 2012. Obesity prevalence was higher among Hispanic, 22.4%, and non-Hispanic Black youth, 20.2%, than non-Hispanic white youth, 14.1%. The prevalence of obesity was lower in non-Hispanic Asian youth, 8.6%, than in youth who were non-Hispanic white, non-Hispanic Black, or Hispanic. 8.4% of 2 to 5 years old were obese compared with 17.7% of 6 to 11 years old and 20.5% of 12 to 19 years old. Obesity and extreme obesity among U.S. lower-income preschool-age children went down for the first time in recent years, according to CDC study. From 2003 through 2010, the prevalence of obesity decreased slightly from 15.21% to 14.94%. Similarly, the prevalence of extreme obesity decreased from 2.22% to 2.07%. Extreme obesity significantly decreased among all racial groups except American Indian Alaska Native. The greatest decrease was among 2 years old and Asian Pacific Islander children. This study found that parents are worried about talking their children about their weight because they are afraid it leads to an eating disorder or lower self-esteem. The authors argues that family must be involved to address childhood obesity, and the communities need to involve in health promotions and educate families to change their lifestyle. Authors are examine the relationship between socioeconomic status and the obese overweight status of children and adolescents. Economic status variable that significantly influences childhood overweight were identified. Low economic status increased the probability of childhood overweight. The authors' concerns about the increasing rates of obesity in developing countries have led many listeners to question the impact of maternal and early child nutrition on risk of later obesity. The purposes of the review are to summarize the study on the association between nutrition during pregnancy and infant feeding practice with later obesity from childhood through adulthood, and to identify potential ways for preventing obesity in developing countries. The authors state that obesity is serious health problems worldwide. This study focused on the interactions between obesity and genetic polymorphism and the development of metabolic complications. They found evidence to play a role in obesity are associated with metabolic complications through genetic association that including genes. The study also found that genes interact with other factors such as lifestyle and physical activity. Here is my web of causations diagram. By using their strengths-based perspectives, social workers can help children and adolescents make positive lifestyle changes such as healthy eating and exercise habits. Center helping obesity in children and successful. This community's target population is obese and overweight children and their families. Goal of choices is to provide parents and activity behaviors of children and adolescents are influenced by many sectors of society, including families, communities, schools, childcare setting, mental care provider, faith-based institutions, government agency, the media, and the food and beverage industry and the entertainment industries. As a social worker, we need to provide a service to individual or family, such as support group, treatment program, wellness initiative. In addition, we need to educate children and families to change their lifestyle.